Hi, this is Mark Garrett here, co-owner at National Senior Savings. This 8-part Medicare learning module will be brought to you by National Senior Savings and the podcast, The Medicare Minute. You can check our website out at nationalseniorsavings.com or go to iTunes or Google Play Music and you can listen to us at The Medicare Minute. So, today's first module is, what is Original Medicare? So first I want to set the tone that we are in no way affiliated with Medicare or CMS. We simply provide free, unbiased educational videos to help people understand how Medicare works and what their options are. Any opinions expressed here are a result of 34 years working in the health insurance and healthcare industries. They are only observations that we have found to be true. We do not speak for or represent any insurance carriers, and opinions expressed here are our own opinions meant to assist Medicare recipients with finding information on the choices they have available to them. These modules are specifically for educational purpose, and you as an end user should do your due diligence to verify what best matches your needs. And with that mouthful being said, let's get into it. So, what is Original Medicare? Medicare was established in 1965 and took effect in July of 1966. It is a government-run insurance plan. It is the largest health insurance plan in the United States. There's approximately 57 million people on it as we speak today. 11,000 people daily become Medicare eligible. Original Medicare consists of two parts. Part A and Part B were the original two parts. In 2006, Part D prescription drug coverage became a core benefit, just like Part A and Part B. It is also required. Let's talk about Part A cost and coverage. So Part A generally is free if a person has worked a total of 10 years or 40 quarters and paid FICA taxes out of their check. That would be where you would see Medicare federal income tax taken out of your check stub every month. And that would be what you're paying for as your Part A. Part A may be purchased if you do not meet the work requirements. Part A covers hospital, SNF, which is skilled nursing facility, hospice, and home health. Part A has a deductible and co-payments for services, and they change every year. So really for this module purpose, I'm not going to talk about hard numbers that much because they do change yearly, what co-payment or what out-of-pocket deductible you would have. The one thing I did want to talk about real quick is that Medicare Part A can be purchased. So we have people that come to this country from overseas. We have people for whatever reason they didn't work 10 years in their lifetime and they need to get Medicare. Well, Medicare comes with a premium for Part A if you did not qualify for that free benefit. Part B cost and coverage. Part B has a monthly premium based on sliding scale income. For the majority, it is $134 in 2017. So that means that every individual making less than $85,000 in a year income, or any married couple making less than $170,000 a year in income in 2017 would only pay the $134. From that point on, it goes up in sliding scale if you make a greater income, and you could pay as much as $400 and something per month as an individual or for each of you as a married couple, depending on that income. The premium is either deducted from your Social Security check or you can be billed quarterly. Part B covers doctors, preventive care, durable medical equipment, and outpatient procedures. There is a deductible and co-payments that change yearly. Co-payments traditionally stay about 20% of the cost of the service you received. The deductible in 2017 was $183. If you do not enroll in Part B and you are not keeping group coverage through an employer, or you're not someone who retired under the federal government system, you will be penalized for Part B if you didn't sign up for it when you initially became eligible for it. That is a 10% penalty per year that you do not sign up for it. Part D cost and coverage. So Part D prescription drug plans, they vary greatly with cost. They vary greatly with the deductible. They don't all have the same formulary, and the plans are required or you will be penalized 1% of the average cost of a Part D plan for each calendar month you do not have the plan. Medicare.gov is the best place to find your perfect plan. So when it comes to prescription drugs, there can be a $400 deductible, but some plans charge more money for the monthly premium and they have no deductible. Really important to tune into the formulary. So the federal government puts out a master formulary, and with that master formulary, each company has to be compliant to a certain extent with key drugs that are in each category of illness. But they don't always have to be the same drugs. So when I say go to Medicare.gov, if you go there and you click Find Plans, you can enter your zip code, your personal information, your drugs, your pharmacies that you use, and it will automatically shoot back out to you the plans from the most cost-effective to the least cost-effective in that order. So in summary, original Medicare is not really difficult to understand. It has the three parts, Part A, Part B, and Part D. And if this was all you had, you would be set. You would be covered and compliant. You can use original Medicare anywhere in the United States that takes Medicare, which is 96% of all providers. You would have a significant amount of out-of-pocket costs, though, and you would have to cover that. So from this point on, any additional Medicare products that you add or we talk about are just icing on the cake. That's all they are, is something that you add to original Medicare to try and offset cost.